Hello, you're welcome. My name is Dr. Dike Victor Kichupu. Today we are going to talk about the difference between sexually transmitted infections and urinary tract infections. Sometimes these two concepts are misunderstood by patients, even by some health workers. So urinary tract infection is a different illness with different process, while sexually transmitted infections are also a group of illnesses that are also different. So it's important to make these differences so that people don't confuse them in the long run. Urinary tract infections are basically some of the infections that affect the urinary tract. That is where the urine is coming from until it gets outside. That includes the kidneys, the ureters, the urinary bladder, and the ureter. And some of the commonest organisms that cause urinary tract infections include the E.coli, proteus, and many others. And the least is what we call the staphylococcus aureus, which can infect the urine. But staphylococcus is not a sexually transmitted infection, but it can cause urinary tract infection, especially people who undergo some instrumentations, like people who pass a urinary catheter if the area is not well taken care of before the procedure. You can move some of those organisms that are usually around the genital areas into the ureter, and that can cause the infection of the urine. People that have urinary tract infections may have frequent urination, painful urinations, or even difficulty in urination. And in some cases, they may also have fever, feeling of unwell, and some other symptoms. So when they come to the hospital, we assess them, do the appropriate investigations, and treat them appropriately.